I'm Erin.
And I'm CJ. We are your fellow student nurses, and we are here today to talk to you about Bubbleher.
So this is a systematic approach that nurses use to assess postpartum women to ensure that nothing is missed when you do your assessment. Breast.
Okay, to assess the breast, you're going to palpate and inspect. You're going to inspect the size, the contour, asymmetry, engorgement, redness, and of course the nipples.
Some abnormalities that you might come across might be nodules or masses in the breast tissue, extreme warmth, and the nipples may be cracked, blistered, fissured, bruised, or bleeding, and this may indicate that the baby is not latching on properly.
So with the baby not latching on properly, we need to watch our mamas, see how they're breastfeeding their babies, and if it's not going right and things aren't working well, you got to teach your mom the pinky, get that baby latching on right, reset. The uterus.
Okay, to assess the uterus, you're going to palpate the fundus. You're going to make sure it's midline and firm, and you're going to measure in finger breaths.
Some abnormalities that you might come across, it might be boggy, and if it's higher than the umbilicus 6 to 12 hours after birthing, you need to investigate for bleeding.
And if you have a boggy fundus, what do? Massage it! Bladder.
B for bladder. You're going to assess the bladder first by asking the patient if she's urinated. Then you're going to palpate the symphysis pubis for any bladder distension.
Some abnormalities that you might come across could be bladder distension. It could be hard, which then you could scan the bladder and catheterize your patient and contact the physician.
To let them know your mama's not peeing. Bowels.
Okay, to assess the bowels, you're going to first ask the patient if she's had a bowel movement or any flatulence. Then you're going to inspect for distension, auscultate bowel sounds, palpate for tenderness, and ask the patient if she's receiving stool softeners.
Some abnormalities that you might find would be no bowel sounds, a distended abdomen, and the patient could be constipated from fear of ripping her stitches.
And we don't want your mama to have a bowel obstruction because that could lead to a lot of further problems that we just don't even want to go into. Lochia.
Okay, the lochia assessment, you're going to inspect for the amount, color, and odor, presence of hemorrhoids, ask the patient how much she is bleeding, and ask the patient how many peritoneal pads she's used in the past 1 to 2 hours.
Some abnormalities that you might come across could be odor, which would indicate infection, large clots, which would indicate poor uterine involution, and a reversal of color change that could indicate bleeding.
So if the lochia goes from alba or serous back to rubra, we can have a really big problem, and you want to always assess that and call your doctor immediately.
Episiotomy and perineum assessment, you're going to assess your episiotomy site every 8 hours. You're going to inspect for irritation, ecchymosis, tenderness, hematomas, and hemorrhoids. Typically, the episiotomy site is edematous and slightly bruised.
There's 4 stages of the laceration. The first is skin and superficial structures. The second stage is through the perineal muscles. The third stage is through the anal sphincter muscle, and the fourth stage is through the anterior rectal wall. Ouch.
The epidural assessment. So you're going to do a visual inspection of the site, and accurate documentation of intake and output is essential.
Some abnormalities of this one include redness, discharge, or edema. A white line through the length of the episiotomy is a sign of infection, along with swelling or discharge. Severe intractable pain, perineal discoloration, and ecchymosis indicate a perineal hematoma, and healing usually takes about 2 weeks but can last up to 4 to 6 months. Wow, that's a long time.
Okay, the assessment of the extremities. You're going to assess for possible blood clots. If the mother had an epidural, you're going to assess for sensory and motor function return.
Some abnormalities of the extremities include edema, warmth, tenderness, and a low-grade fever. The patient may report tightness or aching when ambulating, which is relieved with rest and elevation.
Your pregnancy can put you at a high risk for DVTs, and we don't want our mamas to have DVTs or end up having a PE, so check this.
Emotions. Okay, the emotional status assessment. You want to observe the mother for interaction with family, level of independence, energy level, eye contact with baby, posture and comfort levels while holding the newborn, and sleep and rest patterns.
You want to be sure to take notice of mood swings, irritability, and or crying episodes.
You want to educate every mother on postpartum blues, postpartum depression, let her know that these are normal feelings that she can have, but if they become overwhelming and she has thoughts of hurting herself or her baby, that she needs to get help and offer the resources so that when and if she has those feelings, she can utilize those resources. ROGAM and rubella.
Okay, ROGAM assessment. We're going to assess the mother and fetus blood type. And for the rubella assessment, we're going to draw a titer of the mother's blood to determine if the mother is immune.
Abnormalities would be if the mother is negative and the fetus is positive, and also if the mother is not immune to rubella.
So it's important to know if the blood types of the mom and the fetus, because if mixing of maternal and fetal blood occurs, we can give the ROGAM as treatment to prevent complications in future pregnancies. As for rubella, we want to prevent complications here, now, and in the future. B for breasts. So remember when you're assessing the breast to inspect and palpate for size, contour, asymmetry, engorgement, erythema, and the nipples.
U for uterus. Remember, you're going to palpate the fundus, make sure it's midline, firm, and make sure it's measured in finger breaths.
B for bladder. You want to palpate at the symphysis pubis for bladder distension.
B for bowels. You want to ask your mama if she's had a bowel movement, and you want to inspect for distension, auscultate bowel sounds, palpate for tenderness, and ask the patient if she's on any stool softeners.
L for lochia. You want to inspect the amount, color, odor, and how much your patient's bleeding. So ask her how many peripads she's gone through in the past 1 to 2 hours.
E, episiotomy. You want to inspect every 8 hours and inspect for irritation, ecchymosis, tenderness, hematomas, and hemorrhoids. For the epidural site, you want to visually inspect also.
H, the Holman sign. So you want to inspect the leg for possible blood clots, and if the mama has had an epidural, you want to assess for the degree of sensory and motor function return.
E for emotions. You make sure you want to observe your patient, that she's interacting with her family. She has a good level of independence, and you want to notice her eye contact with the baby, her posture and comfort levels while holding the newborn, and also her sleep-rest patterns. And now remember, it's very important that you tell your patient it's perfectly okay to have an emotional roller coaster.
R. Rogam and rubella. You want to assess the mother and fetus's blood types and also ensure immunity to rubella.
All right, now let's recap. B.
Breast.
U.
Uterus.
B.
Bladder.
B.
Bowels.
L.
Lochia.
E.
Episiotomy.
H.
Homens.
E.
Emotions.
R.
Rogam and rubella.
Alright guys, thank you guys for watching our presentation. The next time you assess a postpartum woman, make sure you bubble
Her.
Bubbleher, bubbleher, bubbleher.
Woo!
This is that ice cold Michelle fight for that white gold. This one for them hood girls, them good girls, straight masterpieces. Stylin', wildin', living it up in the city. Got Chuck's on with Saint Laurent. Gotta kiss myself, I'm so pretty. I'm too hot. Call the police and the fireman. I'm too hot. Make a dragon walk.